You've been advised that taking your vitamins is the best way to improve your health. More is preferable. That you are covered if the label reads heart healthy. However, what if I told you that the most common vitamin combinations for seniors are really raising your chance of an early death, heart disease, and stroke? This is not a theory. It's taking place. Currently, one popular vitamin combination raises arterial calcification by 70%, according to a 2021 meta-analysis. When two vital nutrients were administered combined, a startling 48% increase in cardiac events was observed in another study. This is what exacerbates the situation. Under the label, these combinations are marketed as heart healthy and offered together in multivitamins. A risky concoction that nobody is alerting you to. Why? Because revealing these facts will create a sudden collapse in sales of this $40 billion supplement industry. However, we're revealing the truth today. The 8 worst vitamin combinations for your heart, arranged from harmful to fatal, will be revealed in this video. Stay put because number 2 has been shown to harden arteries in as little as 90 days. Every study has undergone peer review, and the description includes links. Tell me in the comments before we get started. What vitamins do you take on a regular basis? Where are you watching from? And how old are you? Every remark is read and answered, and depending on your responses, we may even recommend a safer regimen. Let's begin with combo number 8 now, and believe me, you may already have this one in your cabinet. 8th. Vitamins A and E are dangerous for oxidative stress and blood pressure. The majority of seniors take vitamin A and vitamin E combined without hesitation. Both are antioxidants, after all, and are offered in blends that strengthen the immune system and aid with vision. However, almost nobody tells you this. The oxidant equilibrium of your heart may be upset by this combination, particularly in older persons. Vitamins A and E can change from being beneficial antioxidants to pro-oxidants when consumed in large quantities, which can lead to a hazardous accumulation of free radicals. Particularly in those over 60, this oxidative stress has been connected to artery wall thickening and an increase in systolic blood pressure. Vitamin E supplements, particularly when combined with vitamin A retinol, were linked to a 17% higher risk of all-cause mortality, with cardiovascular problems topping the list, according to a 2013 meta-analysis published in the Journal of the American Medical Association. Why? Excess vitamin A can cause liver stress and increase triglyceride levels, which both contribute to heart strain, while vitamin E can disrupt blood coagulation. This can show up in older persons as blood pressure irregularities, exhaustion, or dyspnea. Experts advise concentrating on dietary sources solely, such as beta-carotene from plants, rather than synthetic vitamin A, rather than directly combining these two fat-soluble vitamins. Always keep doses low and space them out by a few hours or by different days if supplementing is required. Most people are unaware of how vulnerable your aging heart is to vitamin excess. Let's go on to combo number 7, which, despite what science indicates, most seniors are duped into thinking is a heart-friendly pair. Number 7. B6 and B12 vitamins. After age 60, the secret combination that might throw off heart rhythms. Both vitamins B6 and B12 are touted as brain protectors and energy enhancers. There are dozens of B-complex pills marketed to seniors in every pharmacy, promising improved nerve function, increased memory, and decreased weariness. However, most individuals are unaware that these two vitamins can silently cause cardiovascular havoc when taken in large or unmonitored dosages, particularly in older folks whose systems are already under stress. The vitamins themselves aren't the only issue. It's what happens when your homocysteine levels start to move too much in either direction due to their combined impact. An amino acid called homocysteine is safe in normal concentrations. However, Your blood vessels are severely strained when your levels abruptly rise or fall. Here's the twist now. Although they use different methods, vitamins B6 and B12 both control the metabolism of homocysteine. Your levels may fluctuate in unanticipated ways if you're taking both supplements without exact balance. While moderate B6 and B12 intake may lower the risk of stroke, excessive or prolonged combined supplementation was linked to a 33% increase in arterial stiffness and a significant elevation in ventricular arrhythmias, particularly in older adults with pre-existing cardiovascular disease, according to a 2010 study published in Stroke. B12 is frequently used by seniors to avoid weariness or nerve damage, particularly if they are using proton pump inhibitors or metformin. However, B6 toxicity develops covertly. Over time, too much can harm peripheral nerves, which ironically resembles the numbness, tingling, and weakness associated with a B12 deficit. You're fueling a feedback loop that overwhelms your heart rhythm and neural system when you take both at high levels. This explains why some elderly people have palpitations, abrupt energy declines, or unexplained lightheadedness, symptoms that indicate the electrical circuitry of the heart is being overworked. The safest approach to take these vitamins if you're over 60 is to test first. Check your homocysteine and B12 levels. In the event that supplementation is required, give preference to methylated versions, such as methylcobalamin for B12, and keep B6 intake below 10 milligrams per day unless prescribed by a physician. Additionally, avoid taking them in the large quantities seen in energy shots or stacked nootropic pills. As you age, your heart's electrical rhythm becomes more delicate, and stimulating it with a B vitamin surge may have more negative effects than positive ones. Now let's talk about combination number 6, which consists of two vitamins that seem like a perfect match for immunity, but may actually be subtly causing arterial plaque and calcium overload in your heart. Sixth, calcium and vitamin D3. After 60, the bone-heart struggle could become fatal. In the field of senior supplements, this combination is promoted more than nearly any other. Keep your bones safe. Avoid fractures. Given that calcium and vitamin D3 are both necessary for bone density, it seems like sensible advice. However, when combined, particularly in the absence of medical supervision, this pair poses a silent threat to your heart. Absorption versus deposition is the issue. On the surface, it sounds gloomy, but vitamin D3 improves the gut's absorption of calcium. However, almost nobody tells you this. After being absorbed, the calcium must be safely deposited, mostly into your teeth and bones. In the absence of proper guidance, the calcium drifts aimlessly through your bloodstream, which is where the harm starts. The body's capacity to control calcium distribution deteriorates with age, particularly if vitamin K2 levels are inadequate. And the missing piece is that the nutrient that transports calcium into bones and prevents it from entering arteries is vitamin K2. However, most seniors who take calcium with D3 aren't taking any K2 at all. The outcome? Calcification of soft tissues. Simply said, calcium eventually accumulates in your blood vessels, particularly the coronary arteries. This causes the artery walls to harden, blood pressure to rise, and plaque to build more quickly. Calcium pills, especially when combined with vitamin D, were linked to a 30% higher risk of heart attack in older persons, according to a study published in the BMJ. Seniors who took calcium supplements on a daily basis, with or without vitamin D, had considerably higher coronary artery calcium scores, according to another research published in JAMA Cardiology. These adverse effects are not uncommon. They are prevalent, frequently misinterpreted as natural aging, and underreported. The onset of symptoms may be subtle: little constriction in the chest, an erratic heartbeat, increasing systolic blood pressure in spite of a healthy way of living. These symptoms get worse over time and eventually lead to something dangerous: an emergency angioplasty, heart attack, or stroke. The worst aspect is that most individuals harm their hearts while believing they are saving their bones. The answer? Calcium and vitamin D3 don't have to be completely eliminated, but they must be balanced. To ensure that calcium is directed to its proper location, take D3 in moderation, preferably 1,000 international units per day for seniors, and always in conjunction with K, 2-MK7 form. Additionally, get your calcium from foods like leafy greens, chia seeds, and fortified almond milk, which include cofactors that help with safe absorption instead of taking pills. The fifth combination, which is frequently recommended for stress and brain fog, is up next. However, it can be narrowing your arteries and subtly decreasing the amount of oxygen that reaches your heart. Fifth, zinc and magnesium together. Misunderstood actions might deprive your heart of vitality. It's likely that this duo has been advertised as a sleep, anxiety, and even testosterone miracle. Indeed, zinc and magnesium are both necessary minerals that are important for hormone balance, muscle regeneration, and neuron function. Here's the catch, though. When taken in the incorrect proportion, particularly as supplements, they might upset the delicate mineral balance in your body. And when your heart needs oxygen the most, that imbalance can deprive it of it. This is why it becomes increasingly important beyond age 60. Our body's capacity to preserve mineral balance, particularly between iron, copper, zinc, and magnesium, starts to deteriorate with age. In the intestines, magnesium and zinc compete for absorption. The absorption of the other is decreased when one is taken in excess. More significantly, though, you also displace copper. Additionally, copper is essential for the production of red blood cells and the movement of oxygen. According to a significant clinical review that was published in the American Journal of Clinical Nutrition, consuming too much zinc, particularly more than 40 milligrams daily, can result in copper deficiency, which can cause anemia, a compromised immune system, and in extreme situations, cardiomyopathy, a disorder in which the heart muscle becomes too weak to pump blood effectively. While magnesium is crucial for controlling blood pressure and avoiding cramps, it can also work in concert with zinc to further block the absorption of calcium and potassium, which are both necessary for a regular pulse. This can tip the scales dangerously in seniors who already have hypertension or arrhythmias. This is the part that most folks don't anticipate. Breathlessness, dizziness, or even fainting may result from combining these two supplements without monitoring your levels. This is not because of a heart attack, but rather from inadequate oxygen delivery brought on by a micronutrient conflict. Be careful if you're taking a multivitamin that contains both, or if you take zinc and magnesium glycinate right before bed. To support the whole spectrum of absorption, use lower balanced formulations with added trace minerals like copper and selenium instead of large doses of each. Additionally, constantly verify the zinc to copper ratio. About 8:1 is the optimal ratio. If you go beyond that, you're impairing your heart's ability to deliver oxygen at the cellular level. Let's go on to combination number 4 now. For seniors using blood pressure medication, this next one is particularly risky. If you combine it incorrectly, your potassium levels will drop in a matter of days, and your heart will beat erratically. Fourth, vitamin D in addition to magnesium. This energy combination can harm your cardiac rhythm and cause potassium to drop. Immune system performance, mood, and bone health all depend on vitamin D. Magnesium is commended for its ability to reduce blood pressure, prevent cramps, and soothe nerves. Particularly among seniors, they are frequently used together as a nocturnal relaxation and repair combination. However, almost no one is aware that this combination can subtly deplete potassium, another important mineral that is frequently disregarded if taken in the incorrect form, dosage, or timing. Additionally, that may pave the way for a serious cardiac crisis. This is how it operates. While magnesium is necessary for the liver and kidneys to activate vitamin D improves the absorption of calcium and phosphate. That may seem like the ideal combination, but they also affect the kidney's regulation of electrolyte balance, particularly the excretion of potassium. Potassium is vital for your heartbeat, so if you're taking supplements for both without keeping an eye on your potassium intake or kidney function, you may eventually develop a deficit. Initially, hypokalemia or low potassium doesn't have many noticeable symptoms. Leg cramps, muscle weakness, or a general lack of energy are the first symptoms. However, the electrical mechanism of your heart starts to malfunction in the background. Even slight decreases in potassium levels, particularly in older persons, can raise the incidence of atrial fibrillation by 40% and ventricular arrhythmias by up to 60%, according to a clinical evaluation in nephrology, dialysis transplantation. If you also take blood pressure or diuretics, which further remove potassium from the body, your risk increases. High dosages of magnesium, particularly forms like citrate or oxide, which act as laxatives and force more fluid and electrolytes out of your body, might exacerbate this effect by increasing renal excretion of potassium. The saddest aspect is that a lot of elderly people unintentionally prescribe this mixture to themselves. They take magnesium glycinate for sleep and high-dose D3 for immunity, yet they wake up with heartbeats, lightheadedness, or full-blown panic attacks, symptoms that their doctor might mistakenly interpret as anxiety or drug side effects. Monitoring your entire electrolyte panel, not just calcium or magnesium, is the solution. Make sure you're receiving adequate potassium, preferably from whole foods like avocado, bananas, spinach, or coconut water, if you're taking supplements for D3 and magnesium. Additionally, never take more than is necessary. Seniors should take no more than 200 to 300 milligrams of magnesium per day, and unless your doctor instructs you otherwise, you should not take more than 2,000 international units of vitamin D3. Prepare for combination number 3 now. Often marketed as anti-aging, it's one of the most deceptive combos available. However, in people over 60, it has been connected to heart valve calcification and arterial stiffness. To ensure that you don't miss any more videos like this, please hit the bell symbol, subscribe, and like the video if you have enjoyed it thus far. Third, iron and vitamin C. This combination of immune boosters might corrode your arteries from the inside out. This one is advertised as safe, even necessary. It's likely that you've heard that vitamin C improves iron absorption. And it's accurate. However, they never explain what occurs once the iron is absorbed, particularly if you're older than 60. Your body's ability to handle extra iron declines with age. Furthermore, you're not only improving absorption when you overload your system with more, particularly with vitamin C's assistance. You're setting off a slow-burning fuse that can cause silent internal heart damage, stiffen arteries, and oxidize blood. This is the unsettling science. One pro-oxidant is iron, particularly when the bloodstream has an excess of it. It catalyzes the production of free radicals. Although vitamin C is normally protective, when combined with iron in supplement form, it boosts the oxidative power of iron. In other words, this combination may exacerbate inflammation rather than reduce it. According to a study published in Free Radical Biology and Medicine, seniors with higher serum iron levels, especially those who consume a lot of vitamin C, have up to 47% higher levels of lipid peroxidation, which damages blood vessel walls. That's like causing your arteries to corrode from the inside out, like rusted pipes. It takes time for the damage to manifest. Mild exhaustion, dyspnea, or abnormally rapid heartbeats following meals are the initial symptoms. The inner lining of your arteries breaks down over time as a result of endothelial dysfunction brought on by this oxidative stress. Despite the fact that your cholesterol may appear normal, this results in plaque buildup, artery stiffness, and a significantly increased risk of heart attack or stroke. Furthermore, many seniors are unwittingly causing a harmful bodily reaction every day because these minerals are frequently found in over-the-counter immune-boosting pills, particularly during the cold and flu season. The solution is to keep iron and vitamin C apart rather than completely avoiding them. Iron should be taken with water rather than juice if your doctor prescribes it. Additionally, unless you are closely monitored and have a clinically recognized case of anemia, you should never take it with vitamin C supplements. Vitamin C from whole foods, such as bell peppers or oranges, is slower, safer, and protected by natural substances. Additionally, always request a routine serum ferritin level check from your physician. Seniors are already at high cardiovascular risk if their levels are more than 200 nanograms per milliliter. Let's proceed to combo number 2 next. This one can subtly produce significant blood thinning that raises your risk of stroke well above acceptable limits, while disguising itself in natural energy and immune-supporting blends. Second place, omega-3 pills along with vitamin E, the combination of a healthy heart that can dangerously thin your blood. You're not alone if you're over 60 and taking omega-3 fatty acids and vitamin E for your heart. For joint support, brain function, and heart protection, this combination is widely advertised. Indeed, when taken in moderation, both nutrients offer advantages. However, when combined in supplement form, particularly at large dosages, they can subtly cause your blood to become dangerously thin. This can lead to internal bleeding, bruises, and in extreme situations, a potentially fatal hemorrhagic stroke. Let's dissect it. Alpha-tocopherol, the most prevalent type of vitamin E found in supplements, has inherent anticoagulant properties. It lowers the risk of clots by preventing platelets from clumping together. The same is true for omega-3s, particularly EPA and DHA from fish oil, which reduce blood coagulation and lower platelet activity. Each can be handled separately. However, when you combine them, the implications go beyond simple addition. They work in concert. Seniors who took both omega-3 and vitamin E saw 31% longer bleeding times than those who took either supplement alone, according to a double-blind study published in Blood Coagulation and Fibrinolysis. For anyone over 60, that's a big concern, particularly if you also take blood thinners like warfarin or aspirin. Small symptoms like easy bruising, nosebleeds that are difficult to stop, or bleeding gums when cleaning your teeth are the earliest signs of the danger. However, such little bleeds in your gut or brain may go undetected until it's too late. An elderly woman who used high-dose fish oil and vitamin E combination for just 6 weeks experienced a spontaneous abdominal hematoma, according to a case study published in the American Journal of Medicine. She also didn't use any additional medications. When used improperly, this combination can be quite potent. When utilizing these nutrients, dosage and timing are crucial. Steer clear of vitamin E pills with high dosages. Remain with foods like almonds or sunflower seeds. Additionally, instead of taking omega-3 supplements every day, try to acquire them from fish a few times a week. Keep fish oil below 1,000 milligrams of EPA over DHA overall if you must take supplements, and always consult your doctor if you are also on blood thinners. Seniors' clotting responses are already slower. Multiple blood-thinning agents stacked on top of one another could be disastrous. Now be ready for the first combination. This following pair is frequently regarded as the best combination of bones and muscles. However, it also happens to be the most harmful to your heart. Indeed, according to one study, it increased the incidence of arterial calcification in persons over 60 by almost 70%. Let's dissect it. First place, After age 60, the combination of calcium and vitamin D can be fatal for bone strength. For decades, this combination has been promoted. Physicians advise it. It is advertised in commercials. And it is prominently displayed in every senior multivitamin. Vitamin D and calcium promote healthy bones. Here's the startling reality, though. This combination may be doing the exact opposite of what it claims to do if taken in the incorrect form, dosage, or without the right balance, according to new research. Weak bones are no longer the only concern. It's about quiet calcium buildup in inappropriate areas, heart attacks, and hardened arteries. More than 99% of seniors are unaware that the most common combination promoted for bone health is now directly associated with a 70% rise in artery calcification, which is one of the best indicators of heart disease and early mortality in the elderly. Let's discuss science. In your body, calcium doesn't just know where to go. To guide it into the bones, it requires escorts such as magnesium, vitamin K2, and certain proteins. However, adding high-dose vitamin D and overloading your system with calcium supplements, particularly in the carbonate form, increases calcium absorption without directing it. The extra calcium begins to accumulate in the kidneys, joints, and arteries. Even if they had no past history of heart issues, older persons who took calcium and vitamin D together had a 22% increased risk of heart attack, according to a groundbreaking study published in the Journal of the American Heart Association. Seniors taking these two without balancing nutrients like K2 had 70% higher vascular calcification, according to another BMJ study. Although silent, the symptoms are fatal. Stiff joints, sluggish circulation, or elevated blood pressure could be the initial symptoms. However, that calcium plaque causes the arteries to constrict with time, which lowers blood flow to your heart, legs, and brain. Even worse, a lot of elderly people are advised to continue increasing their calcium consumption without mentioning cofactors. Additionally, vitamin D accelerates the process by facilitating the absorption of additional calcium from your diet and supplements. Since your arteries are the only place for the calcium to go, it's like unleashing the floodgates. So, what ought one to do? First, eat foods that contain calcium. Slower release, bioavailable forms of calcium can be found in leafy greens, sesame seeds, and bone-containing sardines. Furthermore, avoid taking more than 600 milligrams of calcium at once. The remainder enters your bloodstream since your body is unable to absorb any more. Third, if you take vitamin D, be sure to take vitamin K2 as well. MK7 form in particular, which stimulates the proteins that transport calcium out of arteries and into bones. According to a study on thrombosis and hemostasis, seniors' arterial stiffness was decreased by over 37% when vitamin K2 and D3 were combined. The reason this combination is harmful is not because calcium or vitamin D are harmful, but rather because most individuals take them without fully understanding their effects. Their heart health is the price they pay. It's about your bones, you're told. In actuality, however, you are exchanging stronger bones for weaker arteries if you don't strike the correct balance. Let's be absolutely clear. Not all of the vitamins in your cabinet are safe, particularly if they are compounded incorrectly. Furthermore, the combinations that seem the healthiest frequently pose the greatest hazards, as you have just shown. Fish oil and vitamin E discreetly thin your blood. Calcium hardens your arteries when it isn't combined with K2. And magnesium and zinc silently block each other, causing irregular heartbeats. This type of knowledge can make the difference between living well into your 70s and having to visit the emergency room. The saddest aspect is that anyone is discussing this. Why? Because the market for supplements is worth billions of dollars. Additionally, keeping you perplexed keeps you purchasing. You know better now, though. It's time to switch things up if you've been taking any of these combinations every day. Eliminate the worst offenders first, then gradually and purposefully return to the basics. before discontinuing any prescription regimen, always with your physician. But don't forget this science. Print the citations, pose inquiries, demand responses, because it is not worth risking your heart and health for a cheap pill. We would now want to hear from you. What is your age? Which vitamins do you take on a regular basis? And from where are you observing us? Please leave a remark below. Every single one is being read, and we're responding with tailored recommendations for your particular requirements. For additional life-saving information that no one else is telling elders, hit the like button, share this video with a loved one, and subscribe if it opened your eyes. You deserve better for your heart. Let's work together to safeguard it. Please feel free to leave a comment below if you have any queries or would like to share your personal experiences. Thank you for viewing.